All right, folks, we are back here on WLTH 1370 AM. That's 92.7 in the FM dial here in Gary, Indiana. Yes, it is 7:33 in the PM here, August the 22nd, 2025. The future's here. The future's now. You guys know how this goes. Before we get out of here, we got less than a half an hour before Dr. Williams comes in with the 2x4 and starts regulating and kicks me out personally, like Hacksaw Jim Duggan. I definitely wanted to get into this last story because so much misinformation and disinformation is propagated through our corporate-owned media that is owned by Big Pharma, or at least controlled by Big Pharma, controlled by the corporate industrial complex. And much of that is surrounding healthcare. What I hear all the time is America has the best healthcare system in the world. America has the best healthcare system in the world. How come people come here for healthcare if we don't have the greatest healthcare system in the world? Well, something that is not talked about very often in the corporate-owned media owned by Big Pharma and the healthcare industry is that Americans are traveling abroad for healthcare in record numbers. Record numbers of Americans are fleeing to get healthcare because they can't afford it here. Now, what are they leaving for? Many times it's dental procedures. Sometimes it is elective plastic surgery, but it's also for things like cancer treatments and prescription drugs. Oftentimes, Americans go to Mexico, Canada, India, and Thailand even for medical procedures and to get prescription drugs. And this isn't a new thing. Medical tourism has been growing in popularity for years. It is the type of medical tourism is popular with people who have no health insurance plan or plans that make them pay thousands of dollars before their coverage even begins, which is inherently a gyp. Like, I have no idea why people would agree to that. But according to healthcare policy organization KFF, people in the United States owe at least $220 billion in medical debt. Damn. Yes, Florida. Damn is correct. $220 billion. That is what Americans own in medical debt. Big employers also sometimes send people covered by their insurance to other countries. So a lot of people who have insurance through their jobs actually get sent abroad by their job to have whatever expensive medical procedure they need done. Particularly for things like hip replacements and knee replacements or bariatric surgery. Now, imagine having to go all the way to Thailand to get your knee replaced, to get your hip replaced, to get bariatric surgery. Some of these companies actually send their own employees to Mexico for expensive prescription drugs, which is dangerous. I know some of you must remember about 2 years ago, there was a group of black people who got kidnapped in Mexico by a drug cartel when they went down there to one of those clinics for a medical procedure. And I think one of the guys even died. It was a group of friends who went down there with one of their, I think it's one of their girlfriends, and they got kidnapped, and one guy, I think, actually died or was shot. Medical Tourism Mexico actually boasts that patients can save between 35 and 80% on comparable procedures in the United States. Patients also travel because they can get quicker access to some care outside of the U.S. The U.S. Centers for Disease Control and Prevention actually says that millions of United States residents travel abroad for health care annually. So think about that. Millions of U.S. residents travel abroad for health care annually. A lot of them mainly cross the border for dental work, to buy prescription drugs, or receive care like plastic surgery or cancer treatments. Many American patients visit South or Central American countries like Brazil, like Argentina, like Costa Rica for cosmetic treatments, as they can travel cost effectively and can avail themselves to advanced cosmetic surgery. So that is cosmetic surgery. In Mexico, it's a popular destination for American patients who need primary and dental care, which has always been one of the biggest scams of American health care. The idea that your eyes and teeth are not a part of your body. Think about that. Your eyes and teeth are not a part of your body at large. So you can have health care, but then you also have to get dental health insurance, but you also got to get dental insurance. And you got to get insurance for your eyes. Like, what the hell is going on? This is what I was talking about earlier about the elites not fearing us anymore. The rest of the world does not tolerate this. The French, the English, the Irish, the Scottish, the Swedes, the Danes, the Swiss, the Japanese, they don't tolerate this crap from their governments. We do. According to a study completed in 2013 by the Medical Tourism Association, most Americans who obtain medical treatment abroad obtain treatment in Mexico or India. Currently, countries like India and Thailand provide state-of-the-art amenities for critical treatments like hip and knee replacements and cardiac surgery. Some other popular destinations are Singapore, Belgium, and South Africa. The price of a hip replacement surgery varies from $40,000 to $65,000 in the United States, whereas a similar procedure across abroad will cost between $8,000 and $18,000, including traveling expenses. Now, I actually came across this online. This young American woman named Bryn Elise. She actually went to, I believe it was Turkey, to get a full checkup. This is a young woman here. She could not afford to get a full checkup here in America, so she actually flew to Turkey to be able to get some medical treatment. This is what she had to say.
I flew to Turkey to get the most in-depth checkup of my life, and it was the greatest thing I've ever done for my health and my bank account. Doing this in the US would have cost me thousands and taken months to line up, but in one day, we're doing it all. Scans, tests, meetings with specialists, and the price of everything is jaw-dropping. I'm here at the fanciest hospital I've ever seen with a list of mysterious ailments to get to the bottom of, so let's go. I was met by Sam, my amazing translator/coordinator for the day. First thing you'll do is get your blood drawn so they can start running tests. You'll also do an EKG, they'll take your blood pressure, height, and weight, and now we're off to radiology for a chest x-ray and an abdominal ultrasound. We also did a thyroid ultrasound and some more tests, and then we went over to nuclear medicine and did a bone density scan. How amazing is that? Next, you'll break for lunch, and they've really taken hospital food to a whole other level here. They actually brought in a popular Turkish restaurant to handle all the meals, and patients can literally order it to be delivered to their rooms. It's unreal. I did a lot of research for this trip and ended up choosing a Memorial Group hospital because they're accredited by the Joint Commission International, and I have never seen a hospital with so many amazing reviews. Now it's time to meet with the internal medicine doctor and go over my test results. I was trying to play it cool, but I was nervous. We went over one by one the 30 plus scans, tests, and cancer markers I was tested for in depth, and I got to ask all my pressing questions about my health. Now time to visit the gynecologist and do a pap smear, and I was like, cut the cameras. After that, ophthalmology. The doctor said, okay, this is how you see now, and this is how the world should look. Turns out I have astigmatism and your girl needs glasses. Then you'll normally go to a dental examination, but I actually just did one, so we skipped it. Now cardiology, so I did a stress test and a chest ultrasound, which may have been my favorite part of the entire day. I got to see my heart beating in my chest. It was incredible. This is why I love health tourism, because I would never be able to afford this level of care in the United States. And this entire full day package only cost $810. Personally, I'd rather spend $700 on a flight to Turkey, get dozens of tests there, and take a whole vacation than spend the thousands that this would have cost in the United States.
Good Lord. This woman just went to a hospital that looks like a resort, a vacation resort. Got her eyes checked, got her chest checked, got over 30 scans and tests, her blood drawn, her blood checked out, everything. Went to the gynecologist, everything, for $810. $810. Now remember, the next time they tell you that we can't afford this, while they're sending $300 billion to Ukraine, while they sent over $300 billion to Israel, while they spent $6 trillion on wars post 9/11, remember they told you that they can't afford this in the United States. That's what our politicians and the bootlickers say, that they can't afford this here in the United States. Now, remember, so many of the arguments against universal health care in this country are constructed, again, by the healthcare industry, by Big Pharma, by these entities that make billions and billions of dollars off of us being sick. We already spend more on medical care than anybody else, and per person as well. And yet we're the sickest country in the free world. Make that make sense. People who are against Medicare for all say that Medicare for all is too expensive by presenting misleading numbers without the proper context for our unsustainable healthcare spending. Here's the fact. Our healthcare spending is estimated to continue rising and will reach nearly $6 trillion a year by 2027. That means, according to the federal government, we will spend around $43 trillion on healthcare over the next decade if we maintain the status quo. $43 trillion. That is more than any country in the world. And even per person, if you just break it down per person, that is more than any country in the world to have the sickest population in the world in a rich country. Medicare for all actually would cost less than our current system. A recent study by Yale epidemiologists found that Medicare for all would save around 68,000 lives per year while reducing U.S. healthcare spending by around 13%, or $450 billion per year. Medicare for all spending would be approximately $38 trillion between 2017 and 2026, according to a study by the Political Economy Research Institute at the University of Massachusetts Amherst. That amounts to about $5 trillion in savings over that time. These savings would come from reducing administrative costs, because that's where they get you. You got to call somebody to connect you to your doctor. In these countries, like this woman just came from, you just go to the doctor. Also, they would allow the government to negotiate prescription drug prices. Other studies by think tanks and agencies have also analyzed single-payer proposals at the state and federal levels. Most have found, the overwhelming majority have found, that Medicare for All would reduce our total health care spending. Even the Koch brothers funded Mercatus Center found that Medicare for All would save around $2 trillion over a 10-year period. Now, why is that important? Medical bills are the leading cause of 62% of all personal bankruptcies. 62% of all personal bankruptcies, medical bills are the main cause. 36% of adults skip or delay or avoid medical care due to costs. And for uninsured people, that is 75%. I know because I've been there. With Medicare for All, most families would spend less on health care than they do now on premiums, on co-pays, on deductibles. Of course, it's not free, and some additional taxes would be needed to pay for Medicare for All, but most Americans would spend less on health care than they do right now. Overall, working families that make around $60,000 a year would pay up to 14% less on their annual health care costs. Now, I know what you're saying. Oh, Scott, wait, if we have Medicare for All, it'll take 85 years to see a doctor. In those countries, they have to wait 20 weeks to see a doctor. That's not true. That's complete bunk. According to a study by Statista, the average wait for a GP appointment in the United States is around 3 weeks. That is between 2 to 10 times longer than Europe. So Americans wait longer to see doctors in this country often, in spite of paying more and getting less. In major U.S. cities, the average wait to see a doctor is 1 month. Emergency room visits in the U.S. have an average wait time of 2 hours and 42 minutes, with some states having much longer wait times. Now, in Europe, European countries generally have shorter wait times than the U.S. A recent study by Statista indicates that the average wait time for a doctor's appointment in Switzerland is 2 days, 6 days in France, and 10 days in the UK and Italy. For non-emergency surgeries, Switzerland and the United States do have shorter wait times on average at 28 days, while Spain and France have the longest. Okay, so that's for non-emergency surgeries. Now, again, it's important to understand that Americans spend more per capita on health care than any high-income country. In 2023, the average American spent $14,570 on health care, according to the Peter G. Peterson Foundation, while the average in other comparable countries is roughly half that amount. One of the more shameful events that I've seen in recent history was the Olympics. Last year they had the Olympics, and you had American athletes. American athletes, our best and brightest and healthiest people, taking full advantage of the free health care that they were getting in the Olympic Village because they could not get it in the United States. And so again, as is the theme of this show, we don't have to take this, folks. We don't have to take this. Oh man, I got to get out of here in a few minutes. Let me take this last caller before I get out of here. What's up, caller? What's up?
First of all, good evening. But when you talk about average wait time,
yes,
I'm gonna just go with the emergency room.
yes.
And we talking here in the United States where I know people that work in emergency rooms.
Okay.
And we have been in emergency rooms, and we see the abundance of people that are going in them. Every 5 minutes, there's 5, 6 people going in them versus other countries. Now, when you
says who?
Huh?
Other people have people too. Other countries have people too.
I think they have peoples, but what I was coming to was, if you look at the average diet in other countries versus what we eat over here and what we digest, we have more, I think we have more, how could you say it?
Preservative?
More to catch high blood pressure.
Yeah, we're fed poison. We're fed poison.
Stuff like that.
We're fed poison.
Yeah, but one thing this guy did tell me, and he's in a position where we can say what we want, but when it all boils down to it, because he has someone coming to him telling him, well, that's why you drive in Rolls Royce, that's why you do this, that's why you do that, and why we paying all this money. And like he said, he told us the guy, they sell plane tickets to them countries every day. All you got to do is see.
I heard that.
You have a good day.
But thank you for your call. I didn't really, I didn't understand that last part, but it doesn't matter. I got to get out of here before Dr. Williams comes in here and kicks me out personally. It's important that we understand, folks, what our rights are. And from what I understood from the caller, yeah, Americans eat crap. I've done that story as well. Our food is literal poison. I've done the story about how many of the additives and ingredients in American foods are banned in much of the world. Our bread is not legally allowed to be called bread in European countries. Countries that have starving people in South America won't take our meat. They won't take our chicken. They won't take our beef. They won't take our pork. We're literally being fed poison here. It's one of the things that I do support about what Robert F. Kennedy has been doing. Robert F. Kennedy Jr. has been doing, a part of the Trump administration and the Maha movement, is getting the poison out of our food. We already know this. We eat poison here. Our food is poison. Literal poison. The rest of the world literally bans stuff that we eat every day. Our milk is not allowed over there. Our beef, our pork, our bread, ingredients in our children's cereal, not allowed in many countries. The fluoride in our water, pretty much every other first world nation has taken fluoride out of their water. So why do we still use it? And this is what I'm saying, and this is why I talk about how essentially both parties are in it together and are just playing good cop, bad cop with us. Because both Democrats and Republicans have both been a part of this. Over the last 40, 50 years, the destruction of Americans' health and well-being. It's important to know your rights. It's important to know that we can't afford to take this anymore.